All right. Hello, everyone. I am Angelique Beslick here with the Healthcare Supply Chain Hub, and I want to welcome you today to the Tuesday Learning Bites. As you guys know, I moved from every Tuesday, Thursday to just Tuesdays. This will help everybody who joins to be able to then take the massive action checklist, work on it all week, and not be pressured to do two of them a week. Because I really want you guys to be taking the value of these learning bites and then going and implementing in your workplace that same week so that it's fresh and you're getting all the value and impact from the learning bites. So here we go. We're starting this week with our Tuesdays 30-minute free hot topics. So let's see what our hot topic is for today. Our hot topic is system versus site. Okay, and you guys probably all know who work at a health system versus at a supplier. Building that dual level governance is super duper important. And I really want to kind of go through why you should have an enterprise strategy, how to turn your system decisions into bedside reality and keep them there, how we want to implement 100% at the bedside, and all the things that go with that. So let's dive right in. Some key takeaways today that I want to go through are number one, understanding the purpose and the scope of a system level governance as far as like strategy, approvals, formulary control, stakeholders, executive sponsors, things like that. And then defining what belongs at the site level, which is implementation, sustainment of your contracts, local validation, that implementation 100% at the bedside, contractual scope creep, things like that. And then learn how we establish clear decision rights, decision making, escalation pathways through that. And I'm going to kind of show you what I've done at some health systems, which was a system level value analysis committee and or council governance structure versus a site value analysis structure, and kind of how those work, and then how escalation pathway works within that, and then identifying how to like monitor compliance and stickiness at the bedside, really just using that site decision making and escalation pathway as your, monitoring sustainability, making sure things stick at the bedside. And then the fifth thing there, creating a rhythm of accountability between both levels. So like burn down reports, space planning, training audits and education, compliance dashboards. If there is a harm event, what does that look like from a system level versus a site level? So excited to kind of dive in to all these key takeaways because they're all very, very important. All right. So first things first, let's like just the elephant in the room, right? The problem that we're dealing with here. Okay, super important, is system level decisions losing momentum at the site. And I've seen it where, hey, it is a health system that's like 15 hospitals, a system level decision was made, but then when it gets down to that implementation at the site level, it loses momentum. And I really want you guys to notice that, hey, I awarded a supplier my entire health system's utilization and spend in a certain product category. That was a system level decision. And once it gets to the site to go implement that 100% at the bedside, and it loses momentum, meaning competitors' product starts to sneak in, at certain departments, or maybe at the ED or at the ICU or in the OR. At one site, some of the competitors' product starts to sneak in. That is losing momentum. That is contractual scope creep happening. And you actually end up losing all the benefits from your system level decision. You'll lose the benefits of, obviously, if you got savings out of that initiative. You lose any other benefits around standardized formulary. You lose the benefit of, hey, we wanted to make sure that when a nurse moves from site to site, maybe a traveling nurse that works at multiple sites within your organization, they love to see the same products on the shelf, but you lose that if a site gets to make a decision against that system level decision. So all those things are very, very important. The other thing is, I've seen problems around lack of clarity on who decides what. If you do not have a strict decision-making governance charter at an enterprise system level, or a value analysis charter that really dictates and clarifies who has decision-making authority, then that's where these things happen. And this is where scope creep happens. The other thing is inconsistent execution and sustainment. So things that will negate your process. If you do not have a great, and we just talked about this last week with Justin Pullen here from Green Security. If you do not have a great vendor credentialing and access control policy, and you're not controlling how those vendors come in and sell their duffel bag full of stuff in at your sites, or you don't have control over how vendors can come in and pitch something at a system level versus at a site level. If you're not watching procurement card spend, we already talked a little bit about P cards in a last learning bite. If you don't control specials spend that comes in through Workday or PeopleSoft Oracle or Infor Lawson into your ERP system, if you're not watching all this inconsistency in spend and utilization, and you're not sustaining that system level decision, that's where problems occur, right? And I will tell you that compliance seems to fade over time. I will say that, hey, we did this amazing spine initiative and we chose three vendors. It was a triple source award, and we communicated it well and we implemented it, and we made sure that only those three vendors are on our shelves, and that award happened and we implemented it. And now you're on year 2 of your contract, and you see it starting to fade. And all of a sudden, there's 6 more vendors in the spine space. You'll see that that compliance can fade over time, especially if you have a new product introduction process, maybe through Lumiere or the system that used to be called MedApproved, wherever you have that happening, and you allow physicians to enter new product requests through new product introduction, and that is happening. Uh, and you allow other vendors outside of that triple source award for spine to bring new products in. If compliance isn't something that you're concentrating on in those 3 years of that awarded contract, that compliance fades over time. So that's where, hey, I did this this spine initiative. We chose 3 vendors. It's a triple source award. It's a 3-year contract with all 3. But if you're not monitoring the compliance within that 3 years, these problems start to arise and compliance starts to fade. So, all right. So why this dual level governance really matters. Thinking about like system level having this governance over strategy, standardization, approval authority. Of course, they're going to have contractual approval and signature authority, but approval authority of what comes in your doors. And then thinking about this site level is they're the ones who are executing it. They're implementing it 100% at the bedside. They're sustaining it. They're giving us feedback at a system level. So think about, you could negotiate for the best contract terms, the best pricing in the industry, but it is only as good as you implement it 100% at the bedside. So I am so proud of the contract I wrote. I feel we got the best tier. Well, that tier only matters if your spend stays in that qualified spend tier, right? In that qualification of that tier spend. The terms and conditions only are as good as you're executing on that 100% at the bedside. If you've got several sites within your enterprise or your organization that are doing their own thing outside of that awarded contract, or if you have certain departments that have decided, yeah, we're not going to participate in that contract. We're going to do something different. That's where that dual level governance may not be happening. So the system level, they're there for strategy, standardization, that approval. And that site needs to be executing, implementing 100% of the bedside, sustaining that. And they should be that feedback loop. So if at your site value analysis meetings, the teams are not actually giving the feedback saying, hey, we have 6 physicians here that absolutely hate the award of the three awarded spine vendors. That feedback is so important. I'd rather at a system level receive that feedback. And at a system level, we talk about that in our value analysis system level committee. And then we strategize about that. And then we approve something versus a site going off and doing their own thing just because they don't like what the system level strategy and standardization was, right? So without both of those arms, site level and system level, doing their things that they're supposed to be doing in this governance process and decision making process, you get this chaos in the middle. And then you get frustration, and then you get trust issues and all these things that come with it. And so that is really why this dual level governance really, really matters. Okay. So why system level, or what does system level governance really own? We talked about it a little bit, right? Formulary control. Who are our awarded vendors? What is our primary vendor for that product category? They're actually managing, right? They're managing your product categories, your category management model inside of your item master file. They're managing your supplier master file. They're managing all these things from a system level. Your system organization is managing all those things. So they've got formulary control, item master file control, supplier master file control. They're watching P-card spend. They have all the finance control, finance reporting, contract awards, who are our primary awarded vendors in those product categories. They are then managing and owning the governance of the strategic initiatives you're going to work this year, right? What contracts are expiring? This is all part of contract portfolio management. If I am a contract administrator, I'm managing my portfolio of contracts. I then am saying to the system level governance that, hey, these are the 50 different product categories that are coming up for expiration this year. Which ones do we want to punt out to request for bid? Which ones do we want to just renew because we're happy with the vendor that we currently have today? They're thinking strategically what initiatives are going to be worked this upcoming year. And then they're aligning that with policies. So, my hope is that all of you, as health systems out there, have policies around, hey, we have a policy around who can approve contracts at our health system, who can sign contracts at our health system. We have policies around vendor credentialing and access control. We have policies around procurement card or P card spend. They're aligning all their decisions and their governance with those policies and making sure that those policies are working in favor to control all of this governance. So I hope that that makes sense. So then what does the site level governance own? They have to own implementation planning, burning down of old inventory and making sure that the old awarded vendor, old awarded supplies are off the shelf and getting that new awarded vendor and that new awarded product on the shelf, right? When the system level makes a decision. They will need to make sure that their staff training, our clinicians are ready for go live. There's that go live readiness. Education has happened. We're implementing this new product or this new service. It is the site level to make sure that that happens. And then they are helping with that compliance tracking and sustainment. The reason being is the site level is the boots on the ground. They can see what is coming in the door. They see what's on the shelf. That supply chain team actually at the site, and let's just say you have 15 hospitals, each of those site supply chain teams and clinical teams see what's going on the shelf. I can see our supply chain team at one of our hospitals looking at the PAR location in the ED, for example, and they're saying, hey, I don't know why, but for some reason now we have three different types of toothbrushes. I thought we only had one. And now I just rearranged my PAR location in my inventory space to add two more toothbrushes. I don't know why. Maybe I should escalate that. That is obviously a very simple product, of course, I'm saying. But, as supply chain really digs down into, hey, why do we have three or four of this different type of tubing or catheters or syringes? Maybe there's really good reason for that. You, of course, don't need six different types of 2x2 gauze or six different types of combs or toothbrushes. But when it comes down to tubing, connectors, catheters, syringes, needles, all these things, maybe supply chain at the site doesn't feel comfortable to question why there's so much variation to the standardized formulary. And so maybe they just feel shy to not bring it up. And that's where we need that site level governance to say, that just doesn't look right. Or, hey, that just seems to go against what we're trying to do here is some kind of a standardized formulary. I see we have 18 different vendors for this one product category. It just doesn't seem right, right? So that's where that site level governance kind of has to come in and say, I'm going to raise my hand here. I think we should take a look. Okay. So the handoff, and this is really where the teams fail. So I could have site level governance and system level governance. But are the two of them talking on a regular basis? And how does that communication back and forth happen? Right? So the system, signs off on something and maybe the site doesn't get a playbook or they don't get the communication or, hey, we didn't know that that was converting. What is your health system's process to hand off that system level decided we're moving from the black pen to the blue pen? And hey, sites, Now here's your playbook on how to do that conversion and how to implement and where to implement that 100% of the bedside. Thinking about this visual baton handoff, right? Two gears being misaligned, but also where's the other handoff where this is happening at the site level? Physicians are upset, clinicians are upset, and that is not being communicated back to the system level. That our physicians and our clinicians really do not like this blood pressure cuff, or they really are not liking this catheter, or this connector's not fitting on this tubing. So really making sure that when things like that happen, you're entering a safety event in RL Solutions or whatever safety mechanism you guys use, or you're writing emails and saying, hey, system level folks, this product just is not working for our teams. So really those handoffs have to happen both ways, or it's not a well-oiled machine. I will say that for sure. So building decisions the right way, okay, I want to make sure that all of your teams have what we call a RACI overview in the decision-making process, meaning who's responsible, who's accountable, who's consulted with, who's been informed about all the tasks that have to happen in your decision-making process. And that is why I said in the beginning, start out with a decision-making governance charter from a system level. And then making sure all your value analysis committees or councils also have a charter. That really helps to start your RACI document of who is responsible, who's accountable for what. And then making sure that clinicians, physicians, surgeons, support personnel, supply chain folks, everyone knows their role within that. Everyone in finance knows that it's their job to run the financial impact statements. Everyone in infection prevention and control know that I need to make sure I'm part of these type of decisions, right? And so I really want to make sure that as you're creating charters, you're also creating these RACI documents and matrices so that the value analysis committee knows what their job is at a system level. The site implementation teams know what their job is at the site level. The supply chain teams at corporate know they're supposed to do this. The supply chain teams at the hospital, boots on the ground, eyes and ears of the operations know they're supposed to be doing these things. And that really helps that well-oiled machine really figure out that I'm supposed to do this, you're doing this, well, you're not doing this. And so because I never got communication that a surgeon hates this product, now we lost trust in that surgeon, right? Think just things like that. And then really suppliers, vendors, distributors, GPO teams really have to play a part in that. And honestly, our suppliers need to know what their boundaries and their expectations are. And they should definitely be part of that RACI. So if you guys are doing a spine initiative, do those 3 awarded vendors know these are now my responsibilities? I'm supposed to run a quarterly report. We're supposed to have a monthly meeting to review the processes and the business together. I'm supposed to help be your eyes and ears. If I see competitors' product come in, I will say something. Just things like that. What is the supplier or vendor's responsibility or the distributor's responsibility? And how are they be reporting that? And to whom? When I say this is all a well-oiled machine, this is initiative by initiative. It gets very, very complicated because you're talking about hundreds and hundreds of initiatives. Everyone should lock and step know where they're supposed to be and how. All right. So thinking about this feedback loop, right? Governance without feedback is just a meeting. I always say that all the time because that's really not governing if you don't have the 360 feedback back, right? So we make a decision. We roll it out. We implement it, right? So that's the site level, implementing it. We need to measure. We need to make sure, are we being 100% compliant at the bedside? Do we have competitors' product creeping in, right? We need to report that somewhere. Where are we reporting that to? Back to the system level? How are they then adjusting or holding someone accountable or talking to those vendors that are trying to creep in, right? That are not awarded? Or who is educating our clinicians that, sorry, that is not our awarded vendor right now. That initiative will come back up for renewal in 2 years. We can discuss it then. Who's doing all those education steps? And that's all part of your laying out your governance, laying out your RACI document, who's accountable and responsible for what, who's accountable and responsible for those really tough conversations, right? So those things are all very important in that feedback loop. And I want you guys to think about metrics that matter. What are the metrics that are important for your system level governance structure, your system level value analysis structure, and what metrics matter within that? So compliance, burn down rates, product utilization, P card spend, specials spend, requested volumes, commitment compliance, right? If you have a contract out there with J&J Ethicon and they're saying 80% of your suture and endomechanical spend must be with them, who's running those reports to make sure that your product utilization is 80%? Who's validating that? Who's watching the P card spend for suture and endomechanical to make sure that there's no P card spend at Amazon, for example, or something that's not supposed to be being bought? And then who's validating those? And suppliers, if you're trying to be a strategic supplier with your customers, how are you guys running reports and you're helping to verify and validate that information? And that's like thinking about how we track this stickiness at our organization, that I awarded this vendor all of our business, or these two vendors dual source award for all of our business. How do we track that sticks? How do we track that implementation happened 100% at the bedside? And I really want you guys to be thinking about, at a site level, how you're doing those metrics, but also then how do you report that up to a system level governance, those metrics as well. So those are all very important. All right, so you guys always know, every single time I do a learning bite, I send you guys the recording so that you have it, but also the PowerPoint from today. And then I send you guys a massive action checklist so you can start implementing value tomorrow. So here's just some of the massive action checklists, but you guys know my massive action checklists have a lot of meat in them. So you'll get a lot more than this for tomorrow. But I want you guys to start doing something tomorrow. I want you to take value out of these amazing learning bites, and then I want you guys to go implement. So number one, define your governance structure. Really clarify who decides what at a system versus a site level. Do you guys have charters already? Do you guys have, documented who decides what, who has approval authority, who has signature authority? What kind of policies do you guys have out there for authorization, for disbursements and financial decision making and all those things? And then establish your clear decision rights. In supply chain, who has decision rights? Clinicians, who has decision rights? Who owns what? Build and communicate your RACI matrix so that everyone knows what their role is, and there's no more confusion around who owns this. That is super important. And also some of that may already be spelled out in your governance charter. Then you want to standardize your implementation discipline. Like use go live templates, some kind of playbook, maybe training schedules, burn down strategies. Ensure that every system decision sticks at the bedside, implementing 100% at the bedside. Then you want to sustain your compliance long term. As long as that contract you've awarded with that vendor, 2 year, 3 year, 5 year, you have to sustain that compliance through those years of that contract. So you want to audit it regularly, track your P card and non-contract spend, measure stickiness across the departments, and then you want to close the loop, maintain continuous feedback between system and site governance teams through dashboards, KPIs, sync meetings, scorecards that drive accountability, and then celebrating your success. So, like, if you've really achieved all the benefits from that initiative, whether it was savings, better patient outcome scores, infection prevention and control benefits, you need to be celebrating those things at a site level and at a system level. So my final thoughts about this: governance just is not about control. It's about accountability with clarity. And that really is what it's all about. So I want you guys to really be thinking about your enterprise system level strategy versus your site level strategy. So with that, I'm just going to ask if anyone has a question on the call today, or a thought, or something that you guys want to just say as you went through this training today. Anybody?
Hey, Angelique, it's Heidi. Great job and so much valuable information. I love that you really called out the system level and the site level because there seems to be, there's so much time and energy and effort that goes into constructing a contract. And I think people get really excited because they see the savings. It's the heavy lift, as you said, is on the implementation level. And if nobody's tracking those numbers, it is just such a great reminder because if you're not hitting those utilization parameters, you're missing out on the savings and probably rebates. And so if you're not monitoring that, and if the site level isn't raising their hand to say, hey, to your point, we've got a handful of nurses and physicians that don't like this blood pressure cuff. Well, they're not using it, so we're not getting the utilization. So we need to kind of get on top of that. So thank you so much for calling that out. I think it's really, really critical to be monitoring the data.
Perfect. Thank you, Heidi, for that, because I know that you get it. So I appreciate your thoughts around that. Amazing. Trent, I'm going to call you out because I see you on my call here, and I know that you deal with this every single day. So, do you have any thoughts for everybody here on the podcast?
Well, thank you for calling me out. I appreciate it. I do have some thoughts as your counterpart that completes that transition all the way down to the bedside for our system. I can't emphasize that enough. You have to have a strong hand in hand with the system management of supply chain and the site management of supply chain. And you have to be in lockstep. You have to be on the same page. And then you have to hold each other accountable. There's going to be gaps. There's going to be times where you got to close those gaps. So strong communication, strong governance is absolutely the key to your success.
I love it. Thank you. Thank you for being such a good side by side partner with me. I appreciate you. Anyone else? You guys good? Well, that was awesome. I love it. Well, I hope that you guys have a great rest of your day. And thank you so much for coming on our Learning Bytes today. I hope that you guys enjoyed the topic, and I will see you guys next Tuesday. Thanks, everyone. Take care.